Hi, I am Dr. Sridhar Kalyanasundaram. As a parent, you might wonder what jaundice is. And when we speak of jaundice in general terms, we are worried about liver disease and infections. But the good news is jaundice in babies is not really due to infection, and there is no liver disease involved in the vast majority of these babies. So what really happens is when the baby is in the mother's womb, they have a low oxygen environment, and the baby has a significant number of more red cells than they have after birth. And when these red cells are lost after the delivery because they are in a high oxygen environment, we produce a pigment called bilirubin. And this bilirubin needs to be excreted through the liver. And the liver is not really mature enough to handle this big load in the first week to 10 days. And that's why all babies have this yellow pigment. So when I say all babies, majority of them have jaundice. About 60 to 80% of babies. The babies who are born premature or the babies who are born closer to not closer to full term are more likely to get the jaundice to a higher degree. There are also other problems like blood group differences. Suppose the mother is O and the baby is A or B group or AB group, or sometimes if the mother is Rh negative blood group and the baby is Rh positive, especially from the second baby onwards, if she has been sensitized before with the Rh positive baby, you have a high chance of jaundice. So what exactly happens with this jaundice and why are we worried about it? If the jaundice does go to a high level quite acutely, you may have the jaundice pigment staining the brain and some areas of the brain cells, especially those involved with hearing and movement. This damage may cause long-term issues for the baby, and we want to prevent that happening. And that's why the American Academy, as well as the different pediatric bodies, have brought guidelines where we can monitor the baby right from the first day of life. We have to have a clear policy of how to check the bilirubin, how often to check it, when we need to send the baby home, when we can safely bring the baby back for a follow-up. So it's very important that you follow your physician's advice as far as the timing of discharge and the timing of follow-up is concerned, because they are following the guidelines, the age-appropriate nomograms which are present, and you may have options to see it yourself from the website. And in terms of treatment, if the jaundice reaches a certain threshold, we may have to treat it with blue light called phototherapy. And this is a simple treatment which doesn't harm the child. The eyes need to be covered, the genitals of the baby need to be covered, but the rest of the skin needs to be exposed because basically the blue light falls on the skin and it converts this pigment called bilirubin to a more easily excreted form. And that is how phototherapy for jaundice works. In terms of duration, in the first 5 to 7 days is when the peak of the jaundice happens. So it's very important that once you go home from the hospital, you need to come back for a follow-up visit within 2 to 3 days of going home. That is a crucial time when the jaundice might increase. Feeding is one of the factors that affects the jaundice. So if the baby is breastfeeding exclusively, we need to ensure that you are able to latch the baby well. You are able to confirm that the baby is getting enough milk. And how can you do that? You may be able to watch the urine output of the baby. If the baby is getting enough milk, the baby will start passing urine every 4 to 5 hours or so. The baby will sleep more contentedly, and the weight gain is one of the important measures as well. So these are checked when you come for the clinic follow-up as well. And the pediatrician will advise you. They will do a skin test called bilirubinometry on your baby's skin. That will give us a rough idea whether we need to do a blood test for the jaundice. And if the jaundice level is at a higher level, we may need to do a blood test. And depending on the categorization of the blood test, we may need to treat it. I hope this gives you an overview of newborn jaundice. So stay safe and understand the concerns and ask your pediatrician any questions you may have about this as well. Thank you.